It's a lot of things we're doing, and this is why this initial slide is also a bit busy. So first off, I would like to thank the Royal Perth Hospital Research Foundation, and the team who organizes this. They have essentially brought me from Melbourne to Perth to lead the Dopney Hypertension Centre, to lead clinical research in Western Australia. And research, is so important. You would see on the building around the corner, the Medical Research Foundation building. Today's research is tomorrow's treatment, and nothing is really closer to the truth. And I hope that during today's talk, I can convince you that there's a lot of things that we have been working on, a lot of new advances, how we can help to improve blood pressure control, how we can bring blood pressure down. Today's title of the talk is Take the Pressure Down. Most of you, I guess, would have recognized John Farnham and his beautiful, famous song, Take the Pressure Down. So we hope we can get him onto our campaign, the May Measurement Month, and use his song potentially. And you see the wonderful team here in red. Check your pressure. We are currently in the month of May. And as Kate mentioned, we, for the last 5 years, run the largest blood pressure screening and awareness campaign worldwide in around 100 countries internationally. Over the last 5 years, we have screened around 7 million people. A lot of them were not aware that their blood pressure was elevated, and that is unfortunately the biggest risk. Around half of the people who have elevated blood pressure don't know about it, and obviously you can't take action, or the doctors can't do their job if it hasn't been diagnosed. So we'll talk about some of those during today's presentation. We will have, or I make sure that we have ample time for questions. I do see some familiar faces in the audience, so statistics would tell us that at least a third of the people sitting here will have elevated blood pressure. And I assume it's probably a higher percentage, because why would you come to a blood pressure talk if you're not somehow affected either by a relative or by yourself? So a great pleasure to be here. Big thank you also to the City of Perth for allowing us to use this wonderful venue, and hopefully you'll enjoy what I have to tell you. Kate already did the acknowledgement of country. I would like to repeat that and acknowledge the traditional custodians of the lands we meet, the Whadjuk people from the Noongar Nation, and pay our respects to elders past, present, and emerging. So these are the naked statistics, and it's really a shocker, and you have to look at it for a while. But what this slide illustrates, that globally, high blood pressure, or hypertension as we refer to it, is the leading global preventable risk factor for cardiovascular disease and death. And around 11 million people die every year directly from elevated blood pressure. That's a huge number, and it's very, very hard to digest. And that ranks way before other risk factors such as smoking, dietary risk, glucose or diabetes, overweight, obesity. Naturally, and I'll come to that, all of these risk factors are important, but the biggest bang for your buck in terms of improving health is when you manage and control blood pressure. And that applies to people with high cholesterol, that applies to people with diabetes, for example. So high blood pressure is the biggest global preventable risk factor we have. And to put these numbers in a bit of a better perspective for us in Australia, every single year the number of deaths by the major risk factors accumulate to around 25,500 deaths directly attributable to high blood pressure in Australia. And again, other risk factors equally or similarly important, but hypertension really stands out. And why is this? Now, all our organs are perfused by the vessels, the arteries that kind of perfuse the organs, provide oxygen provides sufficient blood flow such that our brain, our eyes, our heart, our kidneys are really functional. And if there's increased pressure in this system, all of these organs are adversely affected by the increased blood pressure over time. And high blood pressure, for example, is very clearly the most important risk factor for strokes, ischemic and hemorrhagic strokes. So brain bleeds also is very closely associated with high blood pressure. Unfortunately, we learn more and more about the fact that even at mid-age, if you have hypertension, high blood pressure, you are more likely to have cognitive decline down the track, and you are more likely to develop vascular dementia. So if there's something we would like to prevent, it is lowering blood pressure and reduce the risk for these kind of occurrences. Heart failure is another one. Imagine if there's high pressure in your system and the heart has to constantly work against this increased pressure in the periphery. This will wear the heart out over time, and the consequence is usually heart failure. People realize that there's something wrong when they start to get short of breath with minimal exercise or even at rest. And very frequently, it's the fact that the heart is kind of working out. It cannot cope anymore with the current situation. And again, high blood pressure is a very critical risk factor, as it is for heart attacks, kidney failure, and many other conditions. So that perhaps illustrates why blood pressure as a single risk factor is so important, essentially for all organs, and causes these issues. Now, the other important thing to consider is that if we manage to improve blood pressure control, if we've identified elevated blood pressure and we can reduce it, there's dramatic benefit we can get from this. When we manage to reduce the blood pressure by 10 points, let's say somebody here has a systolic blood pressure, so that's usually the first number of 160 millimeters of mercury, which I'm sure many of you would have experienced. If you manage to reduce your blood pressure with lifestyle or with pharmacotherapy, with medication, or by any means, you can expect to reduce your risk of cardiovascular events by 20%. So 10 points reduction, 20% risk reduction. This is huge, and this is something everybody should essentially thrive for. There's also a significant reduction in all-cause mortality by lowering blood pressure. But again, the biggest bang, if you wish, you get in terms of reducing the risk for strokes. High blood pressure is such an important risk factor for stroke, and 10 millimeters blood pressure reduction results in close to 30% reduction of risk of having a stroke, 28 for heart failure, 27 for stroke, but also for coronary artery disease. So again, keep that in mind. If your doctor prescribes you medication and the blood pressure comes down to some extent, you will benefit from that, particularly in the context of reducing your risk. Now, this is the theory, and we've known this for many, many years, so this is not really new. The big problem, and this is why we do these opportunistic screenings, why we run May Measurement Month, why we want people to know their numbers, have their blood pressure measured. Because if we look at the global level, around half of all people who actually have elevated blood pressure, here highlighted in red, do not know that they have a problem. And obviously, if you don't know, if you're unaware, there's nothing you're going to do about it until you may have an event or you may hit the emergency department with a problem, and then it may be diagnosed. So knowing your numbers is very important. But even if we have diagnosed someone with elevated blood pressure, there's still a large proportion of people who've been diagnosed here in orange, but for whatever reason, they have not been treated. And that may be what we refer to as physician inertia, that doctors particularly think, well, it's perhaps not so dramatic and we may not treat, but that's really the wrong approach. In a good proportion, we have diagnosed blood pressure, we've treated the blood pressure, but the blood pressure is not at the recommended level. In Australia, globally, we usually recommend to try to bring your blood pressure down to below 130 for the systolic, the upper one, and 80 millimeters of mercury for the lower one. And if you're below that, you're pretty good. You've reduced your risk dramatically. And that is not always achievable because people may have side effects. Some people just don't tolerate that level of blood pressure, and that's fine. But again, you see only that small part in the dark green is those people who have been diagnosed, who have been treated, and whose blood pressure is in the desired range. So you see so much to do. You know, we only capture around 10-15% who are where we want them to be, but the vast majority is not. And obviously that differs a bit depending on where in the world you look. There's a difference between developing and developed countries, but you get the idea. And interestingly, I guess as Australians, we're probably relatively proud of our health system, and it is a very good health system, particularly if you compare it internationally. Nevertheless, the control rates in Australia are very poor. Only around 23-25% of people with elevated blood pressure in Australia, this is just men in this example, have controlled blood pressure, and we rank way behind other developed similar countries such as Canada, for example, such as Germany, such as the US, New Zealand. So there's something we have to do. And this is why we put out a call to action from people who work heavily in the field. Altas Kutte from the George Institute and University of New South Wales, Gary Jennings, who's the director of the National Heart Foundation, and we got together and we put out a call to action. It's just not acceptable that we do so poorly. We have much better resources and there's much more we can do. And one of the recommendations in this paper was that we need to form a national hypertension task force. We have to put this on the national agenda. And that's what we did in December 2022. We established and formed an Australian National Hypertension Task Force, and the Minister for Health and Aging, Minister Butler, was there to open and to introduce the National Hypertension Task Force and launch it. And we have now essentially all stakeholders involved in this approach. You see very relevant organizations, the Stroke Foundation, the Heart Foundation, the nurses, the Pharmaceutical Society, Kidney Health, Stroke. So everybody you've seen on that initial slide where we looked at the organs that are affected is part of this group. And our aim is by 2030, in around 6-7 years, to achieve a control rate of around 70% as opposed to the 32% we are at currently. So this is very ambitious. We will work as hard as we can to achieve this. But what we need at the end of the day is events like this, where we hopefully manage to increase awareness, where we get people to measure their blood pressure, to know their numbers, and then to take action. And we also have to educate people in how you can actually take the pressure down, as John Farnham said so elegantly. And again, the title of today's talk was that it's perhaps easier than you may think. And what I thought I'd do today, I'll give you a number of examples many of you are probably aware of, and put that into context to highlight that taking control of your blood pressure is actually not all that difficult. Plus, of course, there's a lot of help out there to make sure we can do this. This is thus the roadmap we have developed. So it was a longish process, but everything's now in place. So the sole basis for whatever we do is actually that you guys know your number. And can I have a raise of hands? Obviously, those ones who've just had their blood pressure measured will know it, but who knows their blood pressure? Just raise your hands, please. Yeah, that's fantastic. But that's expected. We're a bit of a biased group, I guess. If we go out on the street, half of the people would probably not know. And if you know your numbers, at least you've got a feel for where you are, and you can raise it, to your health professional. Blood pressure management and blood pressure measurement is critical, and unfortunately that is not always done very well. You've witnessed today how we measure blood pressure. Usually it's advised that you rest for at least 5 minutes, that you sit in a comfortable chair, that the arm is of the level of the heart, and that you have an appropriately sized cuff around the upper arm to accurately measure blood pressure. The same principles apply when you do home blood pressure monitor. Can I have again a raise of hands? Who's got a blood pressure device at home and measures? Wonderful. Gee, this is where we should get to. We need you as a consumer group. We'll sign you all up afterwards for the Dopney Hypertension consumer group. That's terrific. But this slide just shows you all the things that can go wrong if you don't measure blood pressure accurately. For example, a common issue is that if you cross your legs, this is how you should sit, on a comfy chair, feet on the ground, not crossed, back supported, the arm on a flat surface with the appropriately sized cuff around. If you cross your legs, what you do is you inhibit the flow into the periphery, so there's more volume in your vascular system, therefore the pressure artificially will go up. And that can be 2 to 8 millimeters of mercury, 2 to 8 points. So your blood pressure may in reality be quite normal, but you cross your leg and all of a sudden it may be in the abnormal range. So it can go all ways. If you don't use the appropriately sized cuff, for example, if you have a strong arm and you have a cuff that is too small, that cuff needs much more pressure in order to compress the artery, and therefore you get a false high blood pressure. So, these are the little tricks you need to know about, and education is really critical in that regard. But even unfortunately, often in primary care, that's not done quite as good as it should. We're getting better at it, but there's a lot of education involved. So now knowing about this, next time you go to your GP and he measures blood pressure, tell him, this is not how you should do it. You have to do this and this. So we have to educate each other. And I hope you can be a multiplier in what we're saying. Now, the other important message is, this is a bit of a complicated slide, but we don't go through it in detail. What it illustrates is all the factors that can play into blood pressure regulation. And you see there's plenty of them. But the good news is, if we focus on a very important one, and this is lifestyle factors, and this is all in your own control. With a healthy lifestyle, which is very inexpensive, which has usually no side effects, which is very safe, you can usually improve blood pressure control dramatically. And again, this is something I'm sure you've heard from various sources. A healthy diet is important. To avoid alcohol or alcohol in moderate amounts. Don't smoke. Be physically active. Physical activity is not always a great means of losing weight, but it's a great means of getting fitness, strengthening your muscles. So even if you don't lose weight with exercise, it's an excellent thing to do. Weight loss, if you're overweight or obese, is still very important. A good sleep quality is very important as well. We've learned so much about sleep-associated disorders and how they impact on diabetes, how they impact on high blood pressure. So a healthy sleep is critical, and I'll talk a bit about obstructive sleep apnea as one of the contributors to elevated blood pressure. And of course, stress. Now, stress is a very subjective kind of concept. Some people are easily stressed, others are not bothered, so it is very individual. But if people feel stressed, obviously one of the things that happen is certain stress hormones are released. They usually raise blood pressure and have a lot of additional kind of consequences, such as raising glucose levels, thereby potentially predisposing you to the development in the long term of diabetes. So healthy lifestyle is the absolute cornerstone of everything we're doing. And again, you're empowered to use those tools to the best of your ability, and we are here to help with other aspects. We learn more and more about environmental factors, air pollution, particularly in India, China, very closely associated with heart disease, hypertension, and others. So, looking after the environment will help us to stay healthier, and then I think most of us buy into that concept very clearly. Genes obviously play a role. High blood pressure runs in families. If your parents or your siblings have elevated blood pressure, it's much more likely that you will have high blood pressure as well. And high blood pressure we usually consider as a so-called polygenic disease or condition, meaning that there's usually not just a single gene, but it's a number of genes that come together and then predispose you to develop increased blood pressure. Not all that much we can do about this at this point in time, but of course there's a lot of work happening in that space, so keep your eyes open in that regard. Something we work very much on and do a lot of research is this area here. This is almost half the circle, and these are all physiological mechanisms that normally regulate blood pressure. And blood pressure regulation is important. If you exercise, your blood pressure has to go up in order to provide sufficient fuel to your muscles, for example. And it's perfectly physiological that the blood pressure goes up during that times. But once you rest, it should come back down. And there's a lot of mechanisms involved. In red, you've got those mechanisms that usually result in an increase in blood pressure. In green, you have the mechanisms that usually result in lowering of blood pressure naturally. And what we try to do in medical science is we try to inhibit kind of these factors, and we try to support those ones that lower blood pressure and develop pharmacotherapy or drugs to help us to manage blood pressure better. Usually, unfortunately, we do not cure blood pressure. We have to manage it, and that means you have to usually manage it for the rest of your lives. And that means often that you have to take medication, take them regularly, because if you don't take the medications, blood pressure usually goes up again, and the same principles apply. The high pressure will damage the organs and cause issues down the track. So some of those systems, you may be familiar, those ones here in the audience who may be on blood pressure lowering therapy, you're very likely to be on a so-called angiotensin receptor blocker or an ACE inhibitor. Perindopril, telmisartan are very common ones, and they directly inhibit this renin-angiotensin-aldosterone system. There's a lot of other ones which we have, and this is why those drug names are often a bit confusing, because they're chosen to illustrate which system they oppose or support to make it a bit easier for the health professionals to choose the right ones in treating them. Now, very recently, there's a relatively new concept that was just promoted heavily at just the end of the last year. And that really puts one factor in the center of everything that happens down the track, or most of the things, and that is overweight and obesity. And this is referred to as the heart-kidney metabolic syndrome, where it starts with excess adipose tissue, excess abdominal fat in particular, which again a lot of us may have, and it's very common, particularly in developed, but now also very frequent in developing societies. And that may trigger a process whereby, due to the excess weight, due to the fact that these tissues also need to be perfused, we tend to get alterations in blood pressure. Usually blood pressure goes up, fasting glucose levels goes up, lipid levels go up. And if that all happens together, even though it may not be dramatically elevated, if they all work in concert, this is again something that will damage our organs. And at some stage we will feel it by getting symptoms along those lines, what we refer to as kind of subclinical vascular disease. And unfortunately, if we don't interfere early enough, this is where some of us will end up with a stroke, with heart failure, with kidney failure, peripheral artery disease. So the key is really to try to intervene early as possible, identify the risk factors and take care of them. And again, there's lots and lots of opportunities for you to work on. If we talk about obesity or overweight obesity for a moment, it is really almost nothing that is not adversely affected by excess body weight. I will talk a bit about obstructive sleep apnea, cardiovascular disease, very clearly increased in patients with obesity, kidney dysfunction, very common. Obesity is the precursor for the development of diabetes, because in obesity, insulin doesn't work as sufficiently as it does in a lean person. but also cancer, for example, much more frequently in certain types of cancer in obesity. So wouldn't it be great if we can fight the obesity epidemic and reduce weight, which will have dramatic health benefits across the population, but of course also very much for individuals. And this is just a small table to give you an idea how effective these lifestyle modification can be. Weight reduction, we assume or we know from large data sets that if you manage to lose 1 kilogram of body weight, we can anticipate that your blood pressure is going to come down by 0.5 to 2 millimeters of mercury. Or if you lose 10 kilos of body weight, let's say from 130 to 120, we would expect that your blood pressure drops between 5 and 20. Obviously, there's quite a bit of variability. Not everybody responds similarly, but that's huge. That's as good as a blood pressure lowering tablet you can take. If you reduce or if you consume a healthy diet, 8 to 14 millimeters of mercury blood pressure reduction. Beetroot, for example, low saturated foods in low in saturated fats, etc. Salt restriction, particularly if you have elevated blood pressure, has been shown to be quite effective in lowering blood pressure. And a lot of the medications we use actually work better if they're exposed to a low salt environment. So again, lifestyle plus medication, if done properly, can really be very powerful. Physical activity is important, and reducing alcohol consumption. And if you add all this up, it's amazing what you can achieve just with lifestyle alone. Again, this does not necessarily work for every individual person, and we need other means, but it's critical to understand how important lifestyle is. So I usually tell my patients, well, don't have more than a glass of wine perhaps per day, but make sure it's the right size as well. So I'm sure a lot of people here have heard or been perhaps exposed to bariatric surgery, which has been around for a long time, a very powerful means of losing weight. And if we deal with what we call morbid obesity, so excessive adiposity, this is often really the only way to go, and you can see dramatic reduction in weight that is usually sustained over prolonged periods of time, and then comes with usually all the benefits. Surgery, of course, can always have complications, so it's not a black and white, and you have to be aware of those things, but this is certainly something that is available, that has been used widely, and the data are very convincing. A fantastic way to reduce the burden of diabetes, to lose weight, and also to help lower blood pressure and reduce cardiovascular risk. So that has been shown, but obviously this is not our first point of call. Who in the audience has heard about Ozempic? Of course, it's amazing, very hard to get. Ozempic is a so-called GLP-1 agonist. So it stimulates a certain gut hormone that causes satiety. So it makes you, or it fights your hunger sensation, but it has a lot of other benefits. And this is essentially semaglutide or Ozempic. And this drug has been, or this drug class rather, has been very thoroughly investigated. And guess what? It is associated with significant weight loss. Is it indicated for treatment of diabetes? But it is very widely used now to help losing weight, and it's exceptionally effective in that regard. And as we would expect, if you lose weight, you will also have lowering of blood pressure. You have better glycemic control, so your sugars will improve. You lose significant weight. It has a beneficial impact on the heart and the kidneys. You have to go to the toilet usually a bit more frequently and get rid of excess fluid. And it has been shown to have anti-inflammatory effects and thereby reduces the process of development of plaques in your arteries. So amazing drugs and usually quite well tolerated. Gastrointestinal side effects are common. And this is an area of research which is kind of jewel peptide agonists. So this is a drug, tirzepatide or Mounjaro here in Australia, which is even more effective in lowering weight and therefore again have these benefits on other aspects. And you see dramatic reduction, percent change in body weight, more than 20% with the highest dose. And that has been even taken further. Now we have drugs that target 3 of those mechanisms in a single pill, and they are even more effective. We're talking about 25% change of body weight. And again, that will be a game changer in terms of helping people with excess weight to lose weight, to regress diabetes. It will usually also help to lower blood pressure. Obviously, we don't use this drug primarily to reduce blood pressure. We have other drugs to do so. But what it illustrates to me is, again, if we manage to lose weight, and you don't need these drugs, you can do it with exercise and a healthy diet, doing the right thing to a large extent, this will get you those benefits which we now see with these types of drugs. So really, really exciting. Obstructive sleep apnea is something, again, you've heard in the pharmacies. There's a lot of areas where you can screen for obstructive sleep apnea, and it is very common. It's a condition where when you're resting at night, and usually when you're in a supine position, the pharynx kind of closes up and prevents air from trafficking to the lungs, essentially. And you have periods where you stop breathing. And during those periods, usually what happens that your blood pressure drops for that period of time. But once you start breathing, blood pressure goes up again. And that happens during nighttime. People usually feel tired during daytime. But the problem is that these patients or these people tend to have high blood pressure, not only during nighttime, but also during daytime. And obviously, the right thing to do, rather than adding more and more blood pressure lowering therapy, would be to try to take care of the obstructive sleep apnea. And there's ways of doing this. For example, CPAP therapy, masks that people wear during nighttime, and they help to keep the airways open in order to breathe properly. And that usually helps the blood pressure as well, but of course helps particularly symptomatically that these patients feel better, less tired during daytime. And again, there's lots of different masks and things that are available to really suit your individual circumstances. But I really just wanted to highlight all the various factors that come into play. And I'm sure some of you here would have been diagnosed with obstructive sleep apnea. And, again, there's lots of things we can do about those. Now, if lifestyle is not sufficient, obviously this is where we come in. And we usually have our script block, and we write beautiful names on that script block and hand it out to you and say, well, just go away and take this. And we give you some instructions. And we've got wonderful drugs. The majority of the medications we have are usually quite well tolerated, but every drug can have side effects. And if you experience any side effects, if you have to take those drugs, you have to let your health professional know. If you pretend you're taking the medication, but you don't, nobody's served. So, be open with your health professional. Because non-adherence with prescribed medication is one of the biggest issues we face, that patients tell us, yes, I'm taking the drug, but they don't. And if people don't take their pills, obviously blood pressure will not drop. And then we may take a lot of other measures which are not necessarily needed. What is new in the field, and you hopefully have experienced that already, we used to treat high blood pressure by starting you on one medication, a single tablet, a single compound. And then we waited a while, and if the blood pressure came down, that was great. If it didn't come down quite to the level we wanted it, we either increased the dose to the maximum or we added another one. Now, this is essentially out. What we're trying to do now is to start people on the journey earlier, and we start to combine compounds with different modes of action, usually from the start. So if we diagnose somebody newly with elevated blood pressure and it is a certain level, we tend to start with a combination pill. The beauty is it's still just one tablet, so you only have to take one pill, but there's 2 or sometimes 3 different drugs in there. And the beauty is that is more effective, yet it causes less side effects, because the side effects are usually associated with the dose. And if we get away with a small dose, we can usually avoid side effects that, again, are present, and we'll have to be aware of them. So this is kind of the new concept. And as part of the task force, we also have to think about how can we help people in the community to know more about blood pressure, to get some guidance and support. And what has worked very well in other countries, and we're still a bit behind, although there's been a lot of efforts, is to involve pharmacies. And we're extremely fortunate. We have a pharmacist on our team now, Louise, who recently joined us, because this is something we feel will be relevant in order to tap into those 50% of people who don't even know that their blood pressure is elevated, to increase awareness, to give them initial advice, and potentially down the track have pharmacists prescribe medication potentially. Now, this is a bit controversial, and I thought I used the opportunity today. A lot of you would be at a pharmacy quite regularly, and pharmacists are usually very trusted. If you had high blood pressure and the pharmacists could give you a script for a medication following perhaps an algorithm that has been developed by learned societies. May I ask again, just a raise of hands, who would feel comfortable, or perhaps who would feel comfortable with the pharmacist managing your blood pressure, not exclusively? You see your GP still regularly, perhaps 3-4 times a year, but pharmacists are being seen usually 10-12 times more frequently, so there's more opportunity for interaction. So could I have a raise of hands? Who would be comfortable with pharmacists managing their blood pressure? Excellent, that's great. And again, it is a bit controversial, to be frank. Some doctors don't really want pharmacists to prescribe. This issue we'll have to work on. But the concept, I think, has a lot of validity, and I was very fortunate, and we work very closely with my counterpart, Professor Ross Tsuyuki, who's also a trained pharmacist and a cardiologist, and he's currently the president of Hypertension Canada. And Canada is the poster boy worldwide in terms of blood pressure control rates. There's a lot of things we can learn. And we presented at a pharmacist meeting here in Perth 2 years ago and discussed that. And the pharmacists were quite keen to help with that. They were very keen to be educated and learn. And hopefully soonish we're going to start a bit of a pilot trial here in WA to see how that may work, to see how safe it is, to ensure that you're in the right hands and that we kind of bring everybody's game up to improve blood pressure control rates across the globe. And why pharmacies? I mentioned that already. Australians visit their pharmacy about 18 times a year on average. That's huge. So there's 18 opportunities to interact, perhaps to get a bit of education, or just ask questions. And we feel that may be a very important vehicle, essentially, to educate and increase awareness and move forward. This is some data from my colleague Ross Tsuyuki, who published a beautiful study looking at that, and indeed it demonstrated that pharmacist-led blood pressure management resulted in better control. And that's not because GPs are worse than pharmacists, it's just because they are being seen more frequently, blood pressure is measured more frequently, action is taken more frequently, and this ultimately results in better outcomes. And it's just a way of how do we work the system to the best of our ability to facilitate that. I mentioned already that non-adherence with prescribed medication is a big issue. Non-adherence meaning that a doctor writes a script, it gives you the script, tells you have to take this tablet please once every morning. You may fill the script, but then you decide, I don't think I need this, I just don't take it. And that is actually quite common. In fact, in patients with so-called resistant hypertension, so these patients tend to be on more than 3 blood pressure lowering drugs. There's a number of studies that looked at urine samples to screen for metabolites of these drugs. And in 44% of patients, they couldn't find every single trace of the drugs that were prescribed. So they took some, but not all. And around 17% didn't take a single of the drugs they were prescribed. Now, if I believe you're taking the 3 drugs I've given you a script for, but you don't, and the blood pressure remains high, of course, why would it come down if you don't take your pills? I think, oh, this is not working. I have to put more on. I give you another script. You're not going to take it. You end up with 7 medications on the script, but you don't take any. That's not helping anyone. So my advice is really, if there's issues, and there may be manifold, and this is highlighted here, there are sometimes poor understanding of the condition, sometimes financial issues. Raise it with your health professional. There's a lot of things that can be done, but if you stay silent, there will not be a solution, and it's to your detriment. It's really critical to tackle these things. Now, the last 2 or 3 minutes, so we have time for question. I want to spend a bit on the research side of things, what we're doing just next door at the Royal Perth Hospital and the beautiful Royal Perth Hospital Research Foundation building. We have a specific interest, obviously, in high blood pressure, and we are particularly interested in the connection with a certain part of the nervous system, the fight and flight response, the sympathetic nervous system. If we are stressed, my blood pressure goes up. If I'm standing here, I'm a bit nervous, I have to talk to 80, 90 people, my heart rate goes up, my blood pressure goes up, and that helps me hopefully to speak clearly and properly. And after this presentation, everything will come down. But in a lot of people, there's continued activation and sustained activity of this system. So even though you may think you're not in a stressful situation, that system is constantly active and puts pressure and strain on your vessels. And it's particular the nerves that connect the brain and the kidneys that are critical in that relation. And now for around 15 years, we have been working on an interventional approach to lower blood pressure. Rather than taking tablets, we put a wire into the kidney arteries going through the groin, and we can then position this treatment catheter. And the idea is that we try to silence these nerves here in yellow that link the brain and the kidneys. And by silencing these nerves, we should be able to lower blood pressure. And in fact, we now have 3 different devices that can do this. One uses radio frequency, 4 electrodes that fire simultaneously and silence these nerves on the outside of the vessel. This is therapeutic ultrasound. And this is yet another approach where you inject a bit of alcohol in the tissue around the arteries, and again that kind of silences these nerves. That is available, and and we've got now a number of very good trials which clearly show that this lowers blood pressure. And again, we've been the very first in the world to do this here in Australia, and very recently this has been now taken up into the guidelines. So it's now a guideline recommended intervention to help lower blood pressure, and it has been approved in the United States by the Food and Drug Administration. So it will be rolled out now and made available to a lot of other people who may not be controlled with lifestyle or pharmacotherapy, and that usually affects around 10% of the population. So I guess what I'm saying, whatever your problem is, and wherever you are, there is ways of dealing with it usually, and the least you can do is participate in research, get access to the latest developments to hopefully help you individually here and now, but help people down the track to through good research to improve blood pressure control. This is, I think, my last slide, just highlighting all the things we're working on. We have a specific interest in device-based approaches, because we know people don't necessarily always like taking a lot of pills. We've done some work where we again target a little organ in the neck, the so-called carotid body, which we can access again through the vasculature and silence, so blood pressure comes down. Some here in the audience have participated in some of these trials. Actually, this is a really interesting one, absolutely revolutionary, where rather than trying to lower blood pressure in the periphery, we believe that a lot of people with high blood pressure have some subclinical minor inflammatory processes in the brain, which we may be able to target with a very old antibiotic. The clue is that this antibiotic can pass the blood-brain barrier, and we believe by targeting this inflammation, getting rid of this inflammation, we may be able to reduce blood pressure. So this is a study we're doing at the moment, and you've seen already what we do in terms of this intervention targeting renal nerves, or to improve glucose control, we can target nerves that feed into the liver, and we can combine these things. So lots of research happening. This is really what we're very excited about, and we need people to come forward and contribute to this research so we can make advances down the track. So let me summarize, so hopefully something you can take home. Again, high blood pressure affects 1 in 3 adults, so it is very, very common. Chances are you may have it, and with increasing age, blood pressure tends to go up. It very frequently clusters with increased body weight, dyslipidemia, high cholesterol levels, and high glucose. Healthy lifestyle is the best you can do. Cheap, safe, it makes you feel good, has so many other benefits. But if that's not sufficient, there's other ways of helping with losing weight, which are up and coming. But still, we often need medication. Take your medication regularly. If there's problems, raise it with your health professional to find alternatives. And there are alternatives, such as the interventions we just discussed. And see your GP and health professional regularly, and see your pharmacist perhaps. And if you don't know your numbers, we still have time after this presentation for you to have your blood pressure measured. This is the May measurement month. There's lots of information on this website if you're interested as well. Really kudos to my team. They drive everything. I just come and talk a bit and then I go back to the clinic, but they do all the hard work. So everybody here in red shirts, these are the stars of the show, and this is the team just sitting opposite in the Royal Perth Hospital Research Foundation. So with that, I thank the City of Perth, Kate and the team, and thank you so much for coming today. Any questions? Yes, please.
My partner's been on blood pressure medication for probably nearly 20 years now, and the third one has recently been added. Should he inquire into maybe getting a combination pill like you talked about, even though it's not newly diagnosed?
Look, we very much promote and favor combination pills. Having said that, if he is on 3 individual tablets, he has no trouble taking them. There's probably still benefit by having all the 3 compounds combined in one. But I mean, that would be acceptable as long as his blood pressure is in the right range. It is not uncommon that you may require more medication when you grow older. With increasing age, unfortunately, blood pressure tends to go up. But again, with a lot of exercise and a good diet, you can prevent that progression of the blood pressure elevation over time. So at any age, a healthy lifestyle is really critical. But he can certainly ask his GP whether he could prescribe him depends a bit on what compounds these are. Not all of them come as a single pill combination, but the ones that are recommended by guidelines usually do. So you can get away with less pills. Yes, please, at the back.
It's good to see it's not just my dad who refuses to take his medication, because I feel pretty good today. Is there any research into, longer acting blood pressure medications for those people that do forget to take their medication every day? Excellent
points. And again, you're not alone. It is sometimes you go on holiday, sometimes you just forget to fill your script and you don't have the time. We all have busy lives, so that's understandable. Most of the drugs we have are supposed to act for at least 24 hours, and that means you only have to take them once, and that is, of course, more convenient than having to take a drug 3 times a day. Another really exciting development I haven't touched on today, these weight loss drugs, so Ozempic, for example, these are injectable, so they are not tablets, they are drugs you have to inject under your skin. And I guess 10 years ago, people were a bit scared, but these days, a lot of people have experience with it. Patients who have diabetes have always injected themselves. And in fact, we're doing a study as we speak where we use injectables to try to lower blood pressure. And it seems that we may get away with 2 injections a year, and that may have an excellent blood pressure response. So this is early days, but these injectables are now coming into the blood pressure space. They have been around for cholesterol lowering. They have been around for diabetes anyway, for weight loss. And how good would that be for your dad, for example, like a flu jab or something? You need it every 6 months, and it's not that you can forget about it. You still want to do the right things, but it really gives you that peace of mind that you have something on board that will probably keep the blood pressure at bay, and then you do your other things to improve it further. So there's definitely light on the horizon. Yes, please.
The information that we saw on your PowerPoint, the stuff about the different medications, can we access that somewhere?
Oh yeah, so absolutely. If you go on the Heart Foundation website, for example, this was an extract from the hypertension guidelines, which are publicly accessible. So just go into Google hypertension guidelines, and you will see lists like this, which gives you the names, the drug classes, whatever detail you would like to see. So it's all out there. It's all public and very transparent.
Then thank you.
Yes, please. You go.
With regard to exercise, it's stated that you should do it daily, but if you did it, say, 5 times a week, and again, it's stated that if you're walking, you walk briskly. Well, I walk every day for a good hour or so, but with a dog, so it's not briskly. So, would that, the fact that you're walking, the fact that you're doing exercises for 5 hours a day, but not every single day,
Yeah.
does that still work?
Whatever you can do will be of benefit. Any type of exercise, whether that's exercise, running, swimming, or even if you go to the gym, has been shown clearly to be benefit across kind of the health spectrum. Only a little precaution: if you have very high blood pressure, you have to be a bit cautious, and you want to control your blood pressure first, because during exercise, and particularly brisk or rigorous exercise, your blood pressure has to go up. So you don't want to have a blood pressure to start off with of 200 and then it goes even further. That may put you at a bit of risk. If you join a gym, usually they measure these things and make sure you're okay, and then you can deal with it. But absolutely, whatever you can do, the Heart Foundation recommends at least 30 minutes, ideally every day, or at least 5 days a week. Brisk, moderately brisk exercise, I think is the wording, whatever that exactly means. But any exercise, will be useful, and the more you can do, and I'm sure you would agree that it probably makes you feel good. You sleep better if you've been out there, and a dog has been shown, having a pet has been shown to result in better health. And one reason is probably because you go out, whether it rains, whether the sun shines, you get some exercise, and that's what it's all about. So maybe get another dog, a husky or something, that kind of tracks you around. You had a question.
Yes, I wanted to ask you, taking the blood medication, right? It's right that if you take it in the morning, it benefits you more than if you take it in the night?
No. So there was a study which was, which didn't kind of reflect quite the truth. There's now other studies that show the important thing is that you take your blood pressure medication. Sometimes it can make good sense to take it at nighttime. For example, if you have sleep apnea or other conditions. Okay, so in some patients, but in general, the view is that most of the tablets you have to take once a day, and whether you take it in the morning or in the evening will not make a huge difference. But again, in some patients with specific circumstances, that may be useful.
Then my medication that I take, then I'm doing right if I take it in the night.
That is fine. Yep, that sounds right.
Great,
Absolutely.
great. I wanted to ask you something else, but
We'll have time afterwards. That's okay. Terrific. Yes, please.
So if a person does everything right, as what you said, lower their weight, eat the right things and exercise, and they were on medication before, is it possible to get off the medication?
Absolutely. And that's, of course, a bit the motivation, So I guess if you're on 3 drugs and the blood pressure is just controlled, it's unlikely that you can get rid of all. But let's assume you're pretty big, you haven't really done the right thing. You've been sitting in front of the TV every night, had 2 beer and a lot of chips. And if you turn around your lifestyle, absolutely. I've seen patients who just turn things around. They're off all medication we had previously. Our aim is to ensure that we reduce an individual patient's risk. And we do that by targeting these risk factors, lower the blood pressure, bring the glucose and the cholesterol in the right range. And if that's needed to be done with tablets, so be it. But again, if the patient can contribute and turn things around, I'm the first one who's happy to say, look, we can get rid of this tablet, get rid of this one. And that's something that needs to be assessed. Usually we reduce them slowly. We want to avoid a yo-yo effect if we can. But I have very good examples, people who just turned around their lifestyle, and amazing what effects you can see. Doesn't work in every single one. I've got people, of course, young, fit, sporty people who still have elevated blood pressure. They may be related to their genes and other aspects. But even though you may do everything right, you may still have high blood pressure. And then we have to manage it with medication. But it's all out there. Talk to your health professional, trust them, have a good relationship, and know your numbers. So still opportunities to have them done out there. I think we are, pretty much at the end of the time, and Kate wanted to close.